Hey, so Amanda Emerson here. Don't judge my hair at the moment. It was in a hat earlier, so we have like hat hair going on. It's fine. I am starting my first virtual ketamine treatment for my PTSD. I am choosing to record every single episode and treatment because I've been approved to do it from home. And yeah, so we'll see how this goes, right? Here's the instructions that I was given from my psychiatric nurse practitioner. Your prescription and welcome kit are in process. You should receive your tracking information, blah, 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 blah. Okay. So talk with your chosen support person, which is a sitter. You are instructed to have a sitter just around. They don't want them in the room because they feel like that will affect the possible experience. So I have two people. One is one of my friends, and the other designated one is my mom. So one of my friends couldn't make it today, which is fine. So my mom is my other designated. She actually has a camera on me right over there that she's tapping into to kind of like poke it on me, making sure that I'm not like harming myself or doing anything crazy. There's no weapons or anything nearby for me to do anything with. Hopefully, nothing of that is going to happen. I am extremely nervous because the only time I ever did anything that was sort of psychedelic that had a like hallucinogenic affect to it was about 10 years ago, and I didn't like that experience at all. So, but this is kind of one of the last ditch efforts to do something to help me with my PTSD and my chronic pain. So far, everything that I have as far as treatments have just kind of sort of been like band-aid solutions. None of it has actually like fully helped me 100% with my PTSD. It's come a long way, but it's not in a space truthfully where I feel that it's in a functional level. I still struggle a lot and I still have a lot of night terrors and things like that. So, and extreme chronic pain. Um, and chronic migraines all associated from my PTSD. If we can get the PTSD under control, then we can, in theory, control everything else. So, the way that this goes, my support person, my sitter, has instructions for them that were sent to them. So, my mom has those. I am here in my room. It's kind of a nice, calm environment, right? It says to allow for maximum absorption of the medication, remember to allow the tablets to dissolve under the tongue for 10 minutes. Swish the solution several times over 10 minutes like mouthwash. So from my understanding, these pills that I was sent through the compounding pharmacy, these pills will dissolve into a liquid. And then I have to swish this around like mouthwash for 10 minutes in my mouth. And from what I understand, the taste of this is not great, but you do what you gotta do. And then after these 10 minutes, I'm supposed to spit it out like a mouthwash. Like you can't ingest it. So my psychiatric nurse practitioner told me that if I do ingest it by accident or like out of habit, then it will be a longer psychedelic experience that will be like 3 to 4 hours versus about an hour if I spit it out. So, considering I don't really like hallucinogenic situations, I'm hoping that I don't out of habit swallow it. This first go round will be, because this is my first treatment, I will be taking 2 tablets, which will be 400 milligrams for this first session. And then the next session is when they increase. So after 10 minutes, spit out the medication. It says choose an average day. For the first experience or two, I recommend early evening or late afternoon. Right now, it is 4:55 my time in the evening, so 4:55 p.m. On Saturday, April 25th. Please remember to fast for 3 to 4 hours prior to ketamine dose. Water is okay, which I have done. I had a meal probably around 12 today and it's almost 5. So we've fasted enough time, so we're okay. Fasting for longer can increase the intensity. I do not recommend fasting for longer than 8 hours or for most people as it can increase the side effects. Be well hydrated surrounding your dose days, which I have done. I have been pre-hydrating with hydration packs and things like that for the past several days, trying to really increase my electrolyte intake and water intake. Even electrolyte preparations are great choices. You are encouraged to drink fluids during the fasting period. Do not proceed if your blood pressure is higher than 160/100 prior to starting your session. My mom took my blood pressure. So the company is supposed to send you a blood pressure cuff and a eye mask. That packet has not come in yet. My meds came in before my welcome packet has come in. However, We always have a blood pressure cuff around because my background's in medicine and I always sleep with an eye mask. So both of those things are already here. So we're just going to go ahead and do it without the welcome pack being here officially yet because I have my instructions. So we're doing it. Let's see. Oh, and my blood pressure was 128 over 60 today, about 10 minutes ago when my mom took my blood pressure. Record your blood pressure every session in the portal. Take your anti-nausea medication, which is Zofran, which they send that along with your packets. And I took mine at 4:30, which is exactly 30 minutes prior. And they wanted 30 minutes prior. You may take 1 to 2 tablets and repeat this in 2 hours once. Do not take more than 4 tablets of Zofran in a 24-hour period. I took 1 tablet, which is 4 milligrams, and we'll go from there. Hopefully, I don't get too nauseous. Hopefully. Instructions: do some breath work, relaxation exercises, or meditation prior to your experience to help your mind and body relax. Approach each experience with an open mind and open spirit is the best way to receive the gifts this process has to offer. Set an intention. Examples: to grow, to explore, to reset, and to heal are great options. I think my intentions, what I would like for this one is to heal and to reset. Those are two that I would really like to do if it all possible, to reset and to heal. Remember that your setting plays a significant role in your experience. Be comfortable, find the right time of the day for you, limit distractions, and use music, which I will be having my NP recommended a ketamine playlist, which is on Spotify. He said they're really good. So I found one that I think might work for me. And he recommended me using earbuds with them. So that way I can kind of tune out everything, not just like playing, because I thought about playing it on my TV, but he recommended like doing the earbuds and stuff to like kind of drown out any sort of other distractions. So you won't necessarily hear my playlist. I will hear it through my earbuds, but you're still going to watch me. Please remember to hold stimulants, Adderall, etc., ideally the day of the ketamine doses, as you are able to, and space out 8 hours apart from the ketamine when not able. I don't take Adderall anymore. I do take an ADHD medication, but it is a non-stimulant based one. Remember to space sedatives, sleeping medications, benzodiazepines, kava, etc., and opioids 4 to 6 hours apart from ketamine unless otherwise instructed. I take gabapentin 3 times a day. I have withheld my afternoon dose just to make sure. It wasn't one of the ones that they advised to hold, but he did say that if I did take it prior to dosing, that I would potentially have like a lesser experience, like it will dampen it because it's a depressant type experience. So I withheld that just to make sure. And I take trazodone at night for sleep. Basically, doing this now at 5 o'clock means that I could potentially take trazodone tonight to go to sleep, but it'll be about 1 o'clock in the morning when I can take it, technically. Be kind to yourself, journal, relax, meditate, or just rest. My plan is to rest, and I plan on having my journal here, but I probably won't be writing in it very much, I don't think. I think I will more than likely journal out loud to you my thoughts and experiences and what I'm thinking and stuff like that. Please fill out the weekly screening assessments in your Interwell portal, which is the program that I'm using is called Interwell. Log into your portal and click tap start your ketamine experience to begin your session. You can also record each ketamine session in the Interwell portal retroactively by clicking record an offline experience, which will be what I will be doing. I will do a record an offline experience later. I don't really want to have to focus on doing that during any of this. All right. So now that you know my instructions and kind of what I'm doing and what I'm here for, and that this is session 1, we're going to get started. I'm going to go ahead and put a journal and a pen by my side of the bed. But like I said, I'm probably not going to do anything with it. I'm going to dose with this. And they told me to take it like sitting down because I guess it can start to make you a little bit woozy and things like that. And they don't want you to fall. And they want you to have like a cup nearby to spit into it. I have a paper bowl. So, with some paper towels in it. So I will be spitting this out in 10 minutes. I'm going to set a timer on my side of the bed that I have. So you will hear that go off in 10 minutes. I may speed all the session up for you in these boring parts. So that way you're not being like, well, I don't want to just sit here and watch her for 10 minutes swish crap in her mouth. So, which I don't blame you. Okay. So here we go. It's gone. My playlist is on. So we will get go. Intentions are to heal, to reset, and to get unstuck. Hey guys. I am doing my update on my post ketamine treatment. So we are about 28 hours out, something like that, from my first ketamine treatment. It's April 26th. So I just want to kind of update you on how I'm doing since the treatment and what the experience was like for me. Cause I know that I recorded the experience, but I didn't explain anything that I was dealing with at that moment, right? I just went through it and then now I would like to kind of explain it. When I came out of it, I was tired, but I didn't really feel like talking, but I was okay with writing. So I did journal kind of like everything that I saw during my experience. It lasted about an hour and a half or so, an hour and 45 minutes, something like that. And I just kind of like magically came out of it, just sort of magically knew that I was done with my trip, I guess, and I just woke up, got up, it was almost like somebody's alarm went off in a way. It was interesting. During the experience, felt like I was in control. I did not feel a loss of control as far as like feeling like things were just beyond or anything like that. I didn't necessarily feel like euphoric, but I kind of did at times. It was almost like at times I was immersed in it, and at other times it felt like I was like watching a movie. And kind of like, when you're in a dream state in a way. But I felt like it was a purposeful journey. It wasn't just a dream. And that was interesting. I do remember, so when I took the medicine, I took a gulp of my electrolyte water to kind of help to bust up the pill a little bit because it's two pills. They kind of bust up. And then once they bust up into a liquid. And then that liquid is what you slosh around in your mouth for like 10 to 15 minutes. So I did that, and then I spit it into a bowl that I had after that 15-minute timer went off. And, I will say it did taste kinda gross, which they had warned me about prior, but I had, like, my flavored electrolyte water, so it was gross, but it wasn't unbearable by any means. It was doable, and I was able to slosh it around my mouth and just kind of like I would push things to the front and then kinda swallow in the back a little bit just to kinda swallow a little bit of spit, just because you feel that urge to swallow like a normal person would. But to avoid from consuming it and ingesting it, I would kind of push the liquid to the front of my mouth and then kind of make that swallow with my mouth. So that way I could avoid that part of it. I didn't get any nausea. At times I felt super energetic, but if you would have asked me, like I felt like I could get up and go work out and like go to the gym. Those thoughts came through my mind, but like physically, even though I wasn't disabled or anything, I didn't have the energy for that. So it was interesting to like in your mind be like, yeah, let's go do da 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 da. But to know that like physically you're kind of tired. So that was a very interesting dynamic. And then I remember like when it first started kind of kicking in, I was started feeling like a real tingly, like in like my tummy area. And then it just kind of like started at my toes and went tingly all the way up. It was like a slow draw all the way up. And I got very cold. I remember being very cold to the point where I pulled all my covers up. I turned my heating pad on and I turned my fan off. The ketamine soundtrack that I got on Spotify that my psychiatric nurse practitioner recommended was great. I will say that it was a really good one. I will put that in like the show notes for all of this. As far as which one that I used, I really appreciated that soundtrack. It was very helpful. It was also a 3-hour long soundtrack. So the nice part about that was because I didn't know how long my trip was gonna be. I didn't know if it would be 45 minutes or if it would be an hour or whatever. I didn't feel comfortable picking a soundtrack that was only like 50 minutes long. So that's why I chose one that was a little bit longer just in case. And it was very good. It was a good idea to choose a longer soundtrack that was or a longer playlist that was going. So that way I didn't have to try and fumble through that or have it interrupt my time. My mom checked my blood pressure. It was good. Um, and I had my eye mask, which I sleep with an eye mask anyway. I have for years now. So that was totally fine. Oh, I'm gonna actually read my notes because these notes that I took was like fresh after I got up. So that'll be able to kind of like help you to kind of see like where my mind was and stuff. I just did my first ketamine infusion this evening for my PTSD. It was a really amazing experience. I spoke with Jesus multiple times, which I did. That was fascinating. It was a beautiful experience. It was quite ethereal at times. I mourned so many people that have died, which I did. I remember several of the people that have meant a lot to me in my life. Also, I remember encountering several of the patients that I have lost over my career that have haunted me for a while as far as like hard memories from those losses. And I remember grieving that through my session. And it was like I was seeing frame by frame by frame by frame by frame of person by person by person that I lost or that I dealt with, or that was somebody that I took care of as a patient or something like that, that I lost. And it was like I grieved them, but I wasn't sad. It was more of like a letting go. It was like I loved you. I appreciated you. I miss you. I remember crying over my grandmother. And I remember crying specifically over her. That one was hard. I remember my eye mask being wet because I had cried. I went through work trauma. I went through every single traumatic event that I have dealt with, every marriage, every divorce, every trauma that I had that was inflicted upon me, my sexual assault, my domestic violence, several scenes of my domestic violence, several scenes of things that I dealt with. I remember going through that frame by frame by frame by frame, and it was like I would see it, and then I would let it go, and I would just say, "We're gonna lay that down. We're gonna lay that down. We're gonna lay that down." And it was because, like, my intention the whole time was to heal, to reset, and to grow. And those were my intentions going into it, and I remember telling myself that over and over and over throughout that process. You're going to heal, you're going to let go. And I remember asking Jesus when I was talking to Jesus to heal me. I remember that specifically. I remember at times I was walking through various landscapes, and I would walk through um the woods. I would walk through pastures. I would walk on the beach. I remember floating in the ocean. I remember sitting there out on like wooded decks, and that's like immersed in the woods and just watching the sunrise and watching the sunset. And I remember scenes like that. And these are all things that bring me peace in life. These are all moments that always bring me peace. And so it was very tranquil. It was very soothing at times. There were times when I definitely felt like I had all this energy, and I kept thinking about like my daughter and wanting to go walk in the woods with her. She loves to go walk outside and go play in the woods and things like that. And I remember thinking like I'm going to go run around with Lila. I'm going to have the energy to run with my kid. I'm going to be able to go run through the woods with her, and we're going to go explore, and I'm not going to be in pain anymore. And we're going to be able to do these things. I'm going to feel better. I remember I just kind of kept saying stuff like that to myself. It was so interesting. I was by waterfalls at various times, various things through my life where I've done hikes to waterfalls and things like that. So I remember being in these waterfall spaces where I was just standing there, just watching beautiful waterfalls, you know? But again, these are moments that bring me peace. These are spaces that bring me tranquility and peace. At times, I felt like an angel, which I did. It was so wild. And I was flying. And I don't know if you've ever seen the movie City of Angels, but if you've ever seen that movie, it's kind of special in the way that they portray angels and in the way that they act like, they're all around the city, right? Like they're just everywhere and they are always in every moment and things like that throughout all of our lives. And I do believe very strongly that angels are very much all around. But at times it almost felt like I was one of them. And I was doing those sorts of things like what they did in City of Angels where like, I was walking on cliffs and I was walking over overpasses and flying out of nowhere and being able to hear the sunrise. Just fascinating, beautiful things. And it was just really special. I saw space and the stars, which I did. That was awesome. Prior to kind of going into my episode, when I was sitting there sloshing all the medicine around in my mouth, I knew I was going to be bored and I knew that I would only think about like getting that done. So I sat there and I played a game on my phone called Hidden Objects. And it's kind of like if you've ever had the Highlights magazine where you go and you try to find hidden things in this picture. That's what this game is on my app on my phone. And so I was doing that, and that helped me pass the time a lot. Well, the last puzzle that I was doing before I went kind of under was a space scene. So I think in my mind, I was thinking about space, which I absolutely love space. I am always fascinated by the stars and the sky and the moon and things like that. So I'm not shocked that that was kind of considered like a peaceful, explorative space for me to go kind of wander around space. And I did do that. And it brought me a lot of peace. I remembered my body was tingling throughout the whole process. I was super cold. Mentally, I felt like I was aware of myself. I didn't feel out of control though, like I did the last psychedelic hallucinogenic experience that I had like 10 years ago. It was an awful experience. I felt calm. And then post treatment, I felt very calm. I did cry, but it wasn't a sad cry. It was a cleansing cry. And it was. I remember that. I said, I feel more grounded. At times, I do feel like I have a spongy brain. And that's what my psychiatric nurse practitioner told me that I would feel. They'd be like, for over the next like 48 hours, you're going to have like a spongy brain where you can absorb a lot of things. You're going to kind of be more open, more in an open space. And I didn't quite know what they meant necessarily, but I totally understood it after I got out of it. You do feel like, in a weird way, you're kind of like, I need to learn a new language right now. Like you just do these, oddball things. And like I said, in my mind, I was thinking, I can go work out right now. But realistically, like I asked my mom to go make me toast because I didn't really feel like I could get up and like go to the kitchen and stand there and wait for toast to come out of the toaster. I don't know how to explain it. It was like I was extremely tired, but yet my mind was zooming all over the place. It was like almost like pinging. Um, and it's because it was processing. I totally understand what it was doing because like I said, I've done EMDR in the past. And if you've done EMDR, you totally know what that means, where you're just like, my brain is processing. When it's doing things with those pathways, you have this, like, you just feel kind of odd. You just feel off. Things feel a little different. You don't necessarily feel bad. You just know your brain is doing stuff. And because of that, I also stayed off of social media until this morning because I just didn't feel like I would be in an appropriate space to potentially be interacting at all on social media or anything like that. I kept my interactions very, very low. I didn't call people or anything. A few people texted my mom checking in on me and stuff like that. And I think that that was so sweet. I appreciate all the thoughts, all the prayers, all the messages that I had, so many words of encouragement. And I really appreciate that because I was really I was concerned. I knew that I'm running out of options for my PTSD treatment and I just want to get better, right? Like I just want to be able to like do stuff with my kid and I just want to be able to not have night terrors and get through some of this stuff. What else did I say? Let's see. At times I do feel the spongy brain. I felt energized at times, which like I said, that is something that I felt. Thoughts of going hiking, kayaking, running on the treadmill, working out, jumping on the trampoline with my kid, watching movies with Lila, all of these things were things at times that I felt energized to do, all while having my mask on my eyes and being under, like during session. I woke up about 7 p.m. And keep in mind, I started my treatment process at 5 p.m. That's when I took my meds, like all of that kind of stuff, which you have to, do this swishy thing with your meds for 15 minutes. So I wasn't under that whole time, but it was quite a while. I woke up about 7 p.m. and I just felt like I had finished my experience. So I naturally got up and turned things off and put my earbuds away. I was conscious enough to text my mom and tell her that I was done. Now it's been about 1 hour post treatment. It's now 8 p.m. I'm still very cold, and I was. My insides feel calm, and yet I am shivering inside. And that's how I felt. It was so strange. I don't know how to describe it, but I remember putting my electric blanket on, sitting in a chair in the living room, hanging out with my iPad and writing in my journal and just kind of having my electric blanket on and had my mom go get me some toast. And I was hydrating like a mofo. Like I drank a lot of electrolyte water post because I was trying to flush things. My lower back hurt a lot and my lower abdomen was bothering me. And I was like, you probably just need to flush. You probably just really need to flush stuff. So that's what I did. Side note, strange thing, I woke up early this morning, or when I woke up this morning, I weighed like 4 pounds less. So weird. So weird. Let's see. I'm still cold. My insides feel calm, and yet I feel like I'm shivering. My lower back and lower abdomen feel like they're cramping. I think it might feel like my body needs to flush things out. So there you go. So I have drank a lot of my electrolyte water. I will continue to drink and flush. I plan on video recording an update of all of it. Also, I know in the beginning of it all, I was starting to have visions. I raised my hands, and yes, I did. I did do that. What I was seeing at the time, as I was doing that, was I was seeing Jesus, and I was on my knees at his feet, and I was asking him to heal me. I was very light filled and an ethereal feeling. It was a very special feeling. The Bible says every knee will bow. That verse was something that I felt in that moment. I truly did. I don't even know how to describe it. Like it was so ethereal feeling and light feeling. Like I remember I was on my knees and my hands were up like this. Sorry, you can't see. My hands were up like this. And I remember like he was like right there and super calm, loving. I mean, you just felt love. You did. You just felt love. And I felt like I was just very grateful, thankful. And I just felt like he was going to heal me. Like I was just like, you're going to heal me. Please heal me. And I just kept saying that through the whole thing. It felt like I agreed with that moment 100%. It felt so loving, though. I will be pain free. I will heal from my trauma. I will move forward from all of it. I will become unstuck. I will be productive. I will make all of this happen. I will be able to move forward. This will be where I will lay all of this trauma and mess down and where I once and for all move forward from all of it. Here I am now, about 24 hours out. I will say today I have been kind of lethargic, a little bit low energy. I have been very calm today. I have been decently pain-free today. I have. Like I said, I woke up, I was 4 pounds lighter. Now, I will say this, going to sleep last night was a little rough. I did have one very tiny, very, very, very tiny glimpse night terror. It was not as strong as it had been. I was able to move forward from it pretty quick. My body was tired, but getting my mind to settle down was hard. And it was because my brain was in that spongy, like work, 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 work mode. Once I finally was able to sleep, though, I slept very restfully. And then I woke up about 8 o'clock this morning and felt a little like not hungover feeling,
But just how when if you've ever had a hangover, you feel that, like, lethargic feeling? That's kinda how I felt, was like that lethargic feeling. It was more of just like a tired felt like I could take a nap on and off throughout the day. I didn't, but I did just kind of be low activity today. I just kinda was very gentle with myself. I did take a shower, did my hair, didn't do my makeup, did get dressed, um didn't have much of an appetite today, just a little bit of food here and there, but I did go ahead and eat because I knew I needed to. Hydrated a lot and tried to track my pain level. I only took 1 gabapentin pill today, and that wasn't until about 4 o'clock or 5 o'clock this evening, which is not normal for me. Normally, I have to take gabapentin 600 milligrams 3 times a day, and I start in the morning, like, first thing. That is one of the first things I'm grabbing because I wake up in pain every day. I didn't wake up in pain today, and I don't know how long this is gonna last, but I hope it's gonna last. I get my next ketamine treatment on Wednesday, and that is when we will resume another episode. But so far that's where I'm at. But this was a 400 milligram dose that I did. My next dose is supposed to be 600 milligrams. And then I think after that, I think we're going to increase to 900. So as we go along and as the doses go on, of course, the treatment is going to shift, and I'm sure my experiences will be different. But we started out on the lower end because I was very leery of the hallucination and hallucinogenic factor. And I just wanted to make sure that I was okay. And they want to make sure I was okay too. And I will say I was very pleased. I was really very pleased with this session, and I was extremely relieved that I felt like I was in control still. I didn't feel out of control of myself, and that was a relief because I was pretty scared of that, to be honest. I really was. So to be able to have that have it be that way, that was super helpful, and that was super nice. So yeah, uh, so far I'm pleased. Positive so far. So we're gonna keep it going, and I'm gonna keep you guys updated. So, hey guys. So it is the 72-hour post first treatment of my ketamine update. I'm just kind of letting you know like where everything kind of is for me right now. I have had some pretty decent pain control, honestly. And we've had storms, like we've had really bad storms. And normally my pain is like horrendous when it's coming up for storms, or I will also have like migraines and things like that that get triggered really bad during storms. And I've been for the most part okay. I mean, I've had like right now I have like probably I'd say my pain level right here is probably at like a 3, maybe a 4, something like that. Pretty basic, but it just hurts right here, and that's it. And honestly, like I slept like crap last night, but a lot of that was not, I don't think a lot of that was medicine related. That was more, we had storms last night. The power went out for 2 hours. Like, there were other factors. So that kind of like made my sleep a little bit broken, but I still am kind of having trouble getting to sleep. Once I go to sleep, my sleep is long and restful as long as it's not interrupted with the power going out and storms and all that crazy crap. But I still have been like low energy every day. So that I don't really know what to do with, but I have been very content and I have had more of like a grounding feeling. Normally I'm more like angsty and anxiousy and feeling very antsy on the inside, even if I'm not expressing it outwardly, and it causes me to be quite edgy at times. And I haven't been feeling that way. Usually I feel like extremely overwhelmed throughout the week, and that's just not been happening. I've been like really just kind of low key, no problem. I was able to record a podcast last night with one of my friends, and that went really well. I was a little bit concerned though leading up to it because I wasn't feeling that great. I went ahead and kept moving though and pushed through it and did it anyway. And I'm glad I did because I was fine after that. Once I got started, I was okay. But yeah, still just haven't really like done a lot the last couple days because I just have been extremely low energy and I have had a lot of temperature regulation issues. And I don't know if that's related to this or if that's a perimenopause situation, but I've had a lot of issues with getting really, really cold and then out of nowhere, like, I'll shift and I'll get really, really hot. With perimenopause, I typically have temperature regulation issues, but not in this way. Usually, I'll just get, like, really bad hot flashes or I'll be just normal temperature. But I usually just run most of the time run really hot. But with this, like, since this treatment run either extremely cold where I'm, like, almost shivering, or I will run really hot out of nowhere, like, I'll have a hot flash. Also, since my treatment and again, I have no idea if this has anything to do with anything, because my inflammation feels like it has gone down, I'm still losing weight. Like, I lost even a little bit more weight than I lost the other day. I woke up and I got on the scale this morning, and I was another pound lighter. I don't know if that's like an inflammation situation because like my everything's just calmed down. So like I'm just less swollen, or less puffy. I don't know. But I also have been able to skip several gabapentin doses, which is not normal for me. I'm pleasantly surprised at that. Usually I am taking my gabapentin 600 milligrams 3 times a day like clockwork. And I always try to hold one back because I don't like to take all three if I can help it. But lately, especially, I have been taking it like clockwork. I've not been able to skip a dose at all. Lately, I've been, taking Flexeril on top of it. And since my ketamine, I haven't had to do that. I've been able to skip several doses every day, and I have not had any Flexeril in probably 3 days, 4 days. So, yeah, I don't know if any of that's like all related or not. I mean, it's if it's not all related, it's pretty coincidental. Have my second treatment tomorrow. It is gonna be, psychotherapist, supported, so my psychotherapist is gonna be in on that session. I'm gonna ask him if I can record it while he's in session with me. I don't know what he's gonna say, so if he doesn't permit it, then I will just record before the session happens and then afterward, or I will try to, like, block out whatever he does or whatever. I just want my film set up just like I did the other day, just so that way I'm being as transparent as possible and you're not missing treatments. And that way, since this is going to be a psychotherapist supported one, he is going to be kind of asking questions and things like that, like while I'm under. And I would like to be able to film that so I can see my responses while I'm out. And that way you all can as well. So we'll see what happens. Hopefully he will agree to it. If not, I mean, I got to be respectful of that and I will just film before and after, as well. But yeah, so anyway, I just want to give you guys the update and then I'm going to splice all this together so that way you have the first treatment and then 24 hours after and then the 72 hours after and then that will be treatment 1, episode 1 of the ketamine journey and we'll go into episode 2. So, stay tuned. Here we go, right? Thanks guys.